Hi, my name's Dr. Alif Musaji. I'm the award-winning dentist and principal at Oakdale Dental in Leicester, and I've written a book called The Smiling Dentist, which tries to dispel myths about dentistry. And I want this video to share the truth about what we really get up to. I hope you enjoy. Fixed braces are better than Invisalign. Braces have become such a popular treatment now. It's much quicker than it used to be and really super effective. And patients who have teeth that are crooked, crowded, spaced, we can really help by moving their teeth into a position that's nice and straight and giving them a smile that they feel confident about. Now, there's been a huge boom in clear aligners. These are trays that you put in and you wear one after another, and then it progressively straightens your teeth. The most well-known clear aligner system is Invisalign. That's the one that we provide at the practice. There is a misconception that the train track fixed braces are better than these Invisalign type clear aligners, but it's not true. Once upon a time, many years ago, I have to accept that clear aligners were not as sophisticated as they are now, and so fixed braces wear better. But lots of time and investment has been made in making clear aligners better and better, and now they are just as quick and just as effective. The reason I would always recommend a clear aligner over fixed braces though is that they're just so much more flexible. They can be removed, which means that we can brush the teeth properly. We can eat confidently without having to worry about the brace being in all the time. They are very discreet. Most of the time when they're in, people can't even tell. And say you did have a wedding or an engagement or something to go to, just pop them out for that day and catch up on another day. Whereas with fixed braces, we would often have to plan when we could have treatment around engagements and things like this. So that for me would always be my recommendation, that if you're thinking about moving your teeth, I would always look at Invisalign or a clear brace alternative like that. Gum disease is your fault. Just brush better. Gum disease is a really broad topic and a really broad title for a disease as well. Technically speaking, we have two different ones that we lump into that topic. One is gingivitis, which is inflammation or irritation of the gum itself, and periodontitis, which is a more serious disease, one that affects not only the gum, but the bone, that the root of the tooth is held firmly within. Now, if somebody gets periodontitis, it's a very, very serious disease because ultimately it can lead to the teeth wobbling and eventually being lost. So it's a disease we as dentists take very, very seriously. Now, what is it that causes this inflammation or irritation? Ultimately, it's plaque in the mouth. Plaque is bacteria that we all have, but if it's not brushed particularly well or disrupted, then it can organize together to form a wall, okay? And it's that stuff that you can scrape off your teeth in the mornings, that white stuff. So it is really important for us to brush and clean our teeth really well. But there are a number of people within the population who, in some respects, have been unlucky genetically because the same plaque in one person can cause the gum irritation, the gingivitis, but not threaten the support, the bony support for the teeth. Whereas it's about 20 to 25% of the people who are more susceptible to the deep-seated destruction that the plaque can cause. These are the people who need to be really, really careful, brush more thoroughly, visit the dentist more regularly. But it's not fair for us as a profession to dismiss you and just say to you, you must brush better. These are people who need more help, more understanding, and we're here to help and to take the time to coach and educate you and to treat you as well. If you brush your teeth just before you go to see the dentist, they'll never know that you haven't cleaned for 6 months. We're always told by dentists to brush your teeth and not eat sweets. Now, but why is that? Because there are two main diseases that are caused by bacteria that affect the mouth. One of them is gum disease that we've just discussed, and good brushing helps to prevent gum problems, but it's actually the sugar that causes decay. Now, we touched on earlier when we spoke about fluoride that the tooth is made up of lots of minerals. It's these minerals that make the tooth substance really hard, strong enough for us to chew and bite the food that we eat. But these minerals are able to be dissolved and taken out of the structure. And that's because sugar that we eat gets turned into acid, and then the acid dissolves the mineral and can form holes. There is a balance in the mouth though. When we have something acidic, the body scrambles, fights really hard to try and neutralize the acid and wash it away. But that process takes about half an hour to happen. So if we have some sweets, some sugary food, maybe tea with 1 sugar in it, and then the balance is restored, but then we have another sugary treat, and then another, and then another, then our defenses are overwhelmed. And this process happens where the mineral starts to be taken out of the teeth, it weakens the tooth, and then the holes form. So that's why it's so important for us to coach you as a patient and explain that it's not actually the quantity of sugar you have, but it's more the frequency of sugar intake. That's the important thing in trying to prevent decay. And if we can maybe have our sweet intake alongside our meals, it gives plenty of time for the body to repair that damage and try and keep the teeth free from decay. Amalgam fillings are toxic. Amalgam is the name for the material that we put in teeth, the silver or the metal fillings. Now, that particular material has mercury in it. Mercury has been linked with toxicity and with, well, in fact, there's a story. Alice in Wonderland has a character in it called the Mad Hatter. And back once upon a time, hatters used to use mercury in the rim of the hat to make it stiff, and they'd lick it. And that continued exposure to mercury made hatters go insane. And that's where that character, the Mad Hatter, came from. This is why the inclusion of mercury in fillings, there's always been a question mark as to whether it's safe or not. Now, there's been a lot of science done on this, lots of experiments to see what really goes on in mercury fillings. What we found is that when fillings are placed and they've been in the mouth and they are reasonably inert, no mercury comes out of them. And so they are safe at that point. The time that the mercury is volatile and breathed in and I suppose imbibed by the body is either when the filling is being placed or when the filling is being drilled out. Thankfully, for a patient, this doesn't happen very often. But if you think about it, for a dentist, that happens all day, every day. We're forever drilling fillings out or placing fillings. And so if anybody was going to go mad as a result of exposure to mercury fillings, it wouldn't be patients, it would be dentists. Now, arguably, I may have shot myself in the foot with this argument, but joking aside, I can say that the incidence of this effects of mercury are not high amongst dental professionals. And from that evidence, one can logically deduce that mercury is a safe material. Having said that, nowadays the tooth-colored fillings, which we call composite, have become as good, if not better, than the mercury fillings, lasting really well, but also providing for a restoration that disappears into the tooth so that nobody can tell that you've had dentistry done. For that reason, I would always be happier to put tooth-colored fillings in, but I would never suggest to patients, oh, come to me, I'll take out your good metal fillings to change for white. No, I'm happy to do it if there's a problem with the filling, but otherwise, keep what you have. Root canal treatment is painful. One of the questions I get asked the most from patients is about root canal treatment. If they need it, they're really fearful. They ask, is it going to hurt? In fact, most of the time they assume it is. I couldn't be further from the truth. Before we explain why, let's go into why people need root canal. All teeth have nerves in them, and sometimes the nerves can break down, especially if there's a big decay hole in the tooth, because bacteria that are in the decay cavity spread and they find the nerve and it becomes infected, and the infected nerve hurts. If the nerve itself is dying, it can be very painful, but sometimes the nerve dies and then infection can spread out of the top of the tooth, so the surrounding area becomes infected. Both of these instances are times where root canal treatment is needed. Now, if the nerve is dead, then we could clean it out without any anesthetic. We don't normally, we still numb, just to make sure. But we would be able to clean it out and it wouldn't hurt at all. So in those instances, the root canal is never painful. But there are some instances where when the nerve is really, really inflamed, really badly hurt, then it can be a little bit uncomfortable. Now, the only reason for this is when we numb teeth, I often say to my patients, we're going to freeze the tooth. But if the nerve is upset, we often call it a hot nerve. If it's really, really hot, then we freeze it. Sometimes it just takes a little bit longer, and it takes for us to do one or two different techniques. But we can normally get that nerve nice and frozen, get the tooth nice and comfortable, and we are able to do the root canal treatment for you without it hurting at all. Fluoride toothpaste is harmful to your health. Fluoride is a naturally occurring molecule. And the reason we found out as a profession that it was good and helped us to prevent tooth decay is because they used to do studies and work out how many children and adults had holes in their teeth. And they found that there were certain pockets, areas where the incidence of decay was much lower. And what they found correlated was that these were areas where fluoride was naturally occurring in the water. So they decided and they worked out that fluoride was protective, prevented us from getting tooth decay, and so they add it into toothpaste. Now, the nice thing about having fluoride in toothpaste is that we normally brush with it and then spit it out, so we're not taking too much in. Because the honest truth of the matter is that fluoride in very high quantities is toxic, but not if we are brushing with it and using it responsibly as the manufacturers would recommend. If we use it in that way, then it's a really useful thing. And the way it works is that fluoride is a very, very small molecule. And what happens is the fluoride gets actually absorbed into the crystals in the enamel that our tooth is made from. And it binds the crystal together better so that it prevents the minerals being lost, because it's that loss of mineral that causes tooth decay. Having wisdom teeth out is torture. Wisdom teeth are our very back teeth, the third molars. They're the ones that normally come through about 18. And often, nowadays, when they come through, they don't come through fully. Now, why is that? Well, over the last generation or two, we've evolved a much softer diet, okay, less whole foods, and it's this constant chewing and biting of softer processed foods that means that our muscles are less engaged, and it means that the growth centers that make the jaw grow fully are not activated. When the jaw doesn't grow fully, there isn't enough space for those wisdom teeth to come through, either in the upper or in the lower jaw. This leads to what we call impaction. That's the technical term for it. Now, when wisdom teeth are impacted, they can cause problems. Sometimes they don't though. So it's very important for you and your dentist together to understand if it's causing you any problems and whether treatment is justified, because the treatment normally is removal of that tooth. Now, the lower wisdom teeth can be difficult to remove because of the position of them and the way that they can get stuck in the bone. It means bone sometimes has to be removed and a little nick in the gum has to be made. And although the procedure should be comfortable, there is often pain and swelling maybe for 2 or 3 days afterwards. The opposite is true of the upper wisdom teeth. They are amongst the easiest teeth in the mouth to remove. Often it's a very quick 10 or 15-minute procedure with no pain or swelling afterwards. So never be scared about asking your dentist about wisdom teeth, because there should be a very nice approach to justifying treatment if it's needed, and then making sure it's executed in the neatest and tidiest possible way. Whitening is harmful to your teeth. Whitening is a beautiful treatment. It's so safe and so effective and gives us such an amazing result when we do it, well, at least when it's done properly. Now, the thing about whitening is that people assume that it damages the health of the teeth, but this is not true at all. Studies were done in the 60s on people who had had certain types of antibiotics when they were young and their teeth were forming. These antibiotics, called tetracyclines, cause very prominent brown staining. And it was really sad actually and debilitating for these patients. They would walk around with their hand over their mouth, unable or unwilling to smile. And so these patients were willing to do anything to get a smile that they could be proud of. And so they allowed themselves to have whitening for weeks, months, up to a year. And at the end of this time, they were able to have much brighter, whiter teeth. So it did work. It just took a lot longer for these tetracycline patients. But at the end of the treatment, or sadly, if those patients passed on, their teeth were then checked and removed and sectioned so that they could be examined under a microscope. And we were able to see that there was no microscopic damage, and there certainly, when they had been examined, no damage that was visible with the naked eye, what we would call macroscopic changes. So it was concluded, and has been ever since, that whitening is a really safe and really effective treatment, and one that I happily recommend to patients who want it. Implants are better than teeth. In my opinion, dental implants are the best replacement for a tooth. But this is a very important and carefully worded sentence. What I'm trying to get at here is that if we have no tooth, if a tooth has been lost because of decay or pain or gum disease, then a dental implant is the thing that we can provide for a patient that's closest to a tooth. The implant itself, technically speaking, is the false root, and then we put a crown on top and screw it in, and that's the replacement for the bit that we see, the natural crown of a tooth. But in some ways, it's excellent because you can't get decay in an implant. It's all man-made stuff, metal and porcelain. So you can't get holes in implants. But in the same way that the root of the tooth is held in bone, the implant is also held in bone. So there's a biological interface there. Now, the truth of the matter is that that biological interface, the one between bone and tooth, is much stronger and much more resistant to disease than the interface between bone and an implant. So I would never ever suggest taking out a good tooth or a tooth that could be saved and putting an implant in. I'd always much rather save teeth if I have the opportunity and if it's viable. Dentists are scary. I really hope you've enjoyed this myth-busting video today. I don't think I'm scary. I'm going to let you judge, but I really hope you'll agree that not all of us are. Join me again soon. And if you like this video, then please join us again on the YouTube channel and don't forget to subscribe. It's torture. Ooh, painful.